I'm here at Media PSC to discuss a really cool new product called Auggie that's invented by Ashleigh DePopas. So Ashleigh, kind of give us a rundown on how you invented this, why you invented this, and why we need this in our practice.
Yeah, so I came up with Auggie when I learned about the rice method. Women will try on breast implants at home by making their own rice implants. So there's a conversion table out there. You measure a cup of rice, put it in nylon pantyhose.
Like dry rice, right? Not cooked rice.
Yeah, don't cook your rice.
Not steamed rice.
That would change the weight dramatically. And I just thought to myself, there's got to be a better solution. These women are spending 10 grand for this procedure and we're stuffing our bras with rice. So I came up with Auggie. I knew that there were sizers already in the office that you guys use to let your patients try on. Women want to be able to do that at home, and why can't they get them at home? So that was the question I was asking myself, is how can we get these sizers for women who need them for longer amounts of time?
So we'll size in our office and then the patients can get these at home?
Yes. So the way Auggie works is we're a rental service. So a woman will either pick a kit size with her surgeon, or maybe it's pre-consult. She'll decide, hey, I want to try these different sizes on. She rents a kit, comes with 3 different Auggie breast implant sizers, and then you rent them for 7 to 14 days, send them back. You can't get a ton of insights in a short consult when it comes to getting familiar with how your silhouette's going to change, what your clothes are going to look like once you add breast volume, maybe getting advice from your partner on how they feel about the surgery. And what Auggie's allows is that time to thoughtfully consider that decision and really feel good about moving to the next step.
I like it. We actually have a lot of patients that come from out of state, so a lot of times our first interaction with them is a virtual consultation. Right. And I'll say, hey, we're going to send you the rice test. This is how it works, and I agree with you. It just doesn't feel, like it's matching what we're trying to accomplish. And so it seems to make sense something like this, where a woman can have this at home, try it on different outfits. We say, hey, try it on a swimsuit, try it on a dress, wear it around for the day, see how heavy that feels to you or light, and then decide. And a lot of patients come back and say, I thought I wanted 250, I really want 300.
Matt, what do you currently do in your office for sizing?
Well, for sizing, I use a 3D simulation. So that that was one question I had for you. Is in terms of kind of the timeline, do you find it's most helpful to perform a simulation with patients first and then have them use the sizers, or maybe pick a size with the sizers first and then use that for the simulation? I mean, how do you recommend?
I think whatever works best for you, fits into your process, is how you should do it with your patients. So I think Auggie works best with any other sizing tool. The 3D simulation is great for the accuracy of it. I know you get a lot of things that you need out in your surgical planning. Wearing these sizers after the fact gives a woman a chance to say, I like how I look on the screen and in this photo. Let me make sure I also like how it feels when I'm wearing it. So it's really valuable afterwards. But we do have patients getting the kits beforehand. And what's valuable in that scenario is it's typically a woman who hasn't gone to see a surgeon yet. They think they know what they want because they've doom scrolled every before and after photo on the internet, and they don't know if they want to say 350 or 450 or 550, and they use Auggie to kind of help communicate their goals to you at your consult, which can save you time. You guys are now kind of speaking the same language. You're not talking about the difference in bra cup sizing and how that matches CCs. Like, they get the concept of volume. You're still going to use your tools to get the final size. And just being able to kind of relax with your choice that you've made with your surgeon by wearing them can kind of de-stress them in that process.
Actually, why don't you show us what the kits look like?
Sure, yeah. So this is a rental kit of ours. So a woman will go online, order their kit, and this is what shows up in the mail. When you open it, it has 3 sizes in it. We start with our smallest size, which is the 250. You want to take one? And then we go up to the 3. Oh, you guys have the 300s already. And then these are the 350s. So each kit comes with 3 different sizes, increases in 50 cc increments, and then we go all the way up to 500 cc's.
So what type of patients are you seeing online that are wanting to order these and check these out?
Yeah, so there's women who have been thinking about breast augmentation, haven't started the journey of going to start talking to surgeons yet, and they just want to figure out if this is something they actually want to do. Then our breast serious are the women who post-consult just want to feel really good about the recommendation of the sizing with their surgeon. We also have trans women customers. My first customer was a trans woman, and what this does is allow it to be really safe and comfortable to explore sizes in home before you embark on that journey. And then also mastectomy patients, women who had mastectomies and are trying to figure out if reconstruction is something they want to move forward with. This is a great way to play with the sizes and get excited about regaining confidence if you want to proceed with a reconstruction procedure.
And how does a patient order this?
So we are all online, tryaugie.com. It's really simple. You have a couple options. You can either buy, rent for 7 days, rent for 14 days, select your sizing kit. You check out just like any other online shopping site, and then we ship it to your door.
I mean, I think as a surgeon, and you brought this up already, is I think the more touch points that patients have and the more opportunities they have, whether it's 3D imaging or trying it on themselves, the better. I would be all about something like this. Again, I already do the rice test, so I'd rather have something that's not rice in a bag. I think it's great.
I can't tell you how many times, I see a patient for a consult. We see them for the pre-op where we do their sizing, and we talk about the size at both of those time points, and then on the day of surgery they come in, they finally just say, well, whatever you think. If we can help them to arrive at a decision is extremely valuable.
As Jerry said, the more information, the better. The more I'm in your head, the better result I can give you, within reason.